Hello, my name is Blanca. I'm 35 years old. I have 2 children. And the reason I'm creating this video is to share my story with thyroid cancer. And so I'm going to discuss in this video how I got diagnosed. And then maybe in the next video, I'll discuss the subsequent surgery and neck dissection. It's still very fresh. I'm about a week out. Lots of swelling and numbness here. But let's go ahead and get started on how I was diagnosed. So I didn't have any real symptoms. I didn't know I had anything wrong with my thyroid. I had went to the dentist back in October of 2020, and my dentist told me that I had enlarged lymph nodes on my left side. And to get it checked out, I'm sorry if I'm out of breath, but with the surgery just being a week out, it's like kind of hard. So excuse me if that annoys you. Anyways, so my dentist told me I had swollen lymph nodes on one side of my neck to get it checked out. I noted that, but it didn't seem serious, so I lagged on it and really didn't follow up. It wasn't until January 2021 when I was looking at myself or whatever and saw those nut lumps up here, and I was like, wow, so it's been a couple months. I should really get those checked out because they're still present. I made an appointment. I have some notes here. So I made an appointment in January 5th with my PCP. She agreed there was something weird, sent me for CT and just some general labs and a referral to ENT. So my general labs came back normal. My CT came back markedly abnormal due to the multiple enlarged lymph nodes. Bilaterally, but mostly on the left side of my neck, ranging from 1 centimeter to 2. The largest was a lymph node around here, about 2.2 centimeters. At that point, I had made my appointment for my ENT. I went to go see him. He tells me that this large lymph node is leaning against my jugular and it's collapsing my jugular vein. He needs more imaging, but we'll do, a fine needle biopsy on some of the other ones. A week later or so, the biopsy comes back, benign reactive lymph nodes. The MRI gives him better visualization, so I make another appointment a week or 2 later. And he does the fine needle biopsy. At that appointment, he pokes it, right? A fine needle biopsy, they give you a little bit of numbing. Well, this doctor did, other doctors didn't. This particular doctor gave me some numbing. He took a little needle and he would poke the lymph node multiple times to get tissue sample, and then he would squirt it in a little thing. Anyways, so he did that, and as soon as he did that, it started flooding with like fluid. At that point, he said, oh, it's partially cystic. He was pretty shocked because none of the imaging reports had stated that it was cystic, which means that it's solid and has like a cyst type attached to it. He sent all of that off to pathology, waited another week, and basically the pathology came back cellular specimen, insufficient for diagnosis. That was obviously a bummer, as having a very 2.2 centimeter lymph node in your neck that's partially cystic is not normal. So he sent me to his colleague a week or 2 later and to get an ultrasound guided biopsy. I went to that appointment. At this point, they were wondering if I had lymphoma due to all the enlarged lymph nodes. So I was kind of freaking out about that. Anyways, so I go to my appointment for my ultrasound guided biopsy. The doctor does that. This new doctor, his colleague, he gets a sample, he sends it off. A week later, I get a call from my doctor, my ENT, saying we got the results. Unfortunately, it is metastatic thyroid cancer. because they tested a lymph node. And so when it tested positive for like thyroid staining, they knew that it was cancer and it was from my thyroid. I was obviously distraught. I was sad. I was scared. I didn't know what that meant. Getting told you have cancer is scary. But, you know, he gave me a to-do list of more labs, thyroid labs, how to get an ultrasound, how to meet with an endocrinologist. I don't remember everything else, but basically I had a big to-do list at that point. Like, okay, this is your diagnosis. We need to get to work. I go in for the ultrasound and it shows a 1 centimeter nodule on the left side of my thyroid. And then obviously some lymph nodes on the left side, primarily, I think. Yeah. And so obviously that's the source. My thyroid labs that they gave me, that they sent me to, came back normal, which I thought was weird. I was like, how can I have normal thyroid labs but also have cancer? Anyways, I guess it's possible. It's a thing. So at that point, I had to get another fine needle biopsy of the thyroid nodule and other lymph nodes in my neck, right? So they knew this one was cancerous, so they got to test a couple other ones because one of my results came back benign. So I made all the appointments for everything, and my endocrinologist did my 3rd fine needle biopsy. The 3rd or 4th, I can't remember. Anyways, she tested my thyroid nodule. She didn't use any of that the numbing shot. She just did it straight. It is uncomfortable, but it's manageable. You know, definitely got to breathe through it. I've had 2 children. So, you know, it was manageable. Basically, my endocrinologist did a bunch of biopsies, my thyroid nodule and 2 other lymph nodes. And then those came back papillary thyroid cancer. Everything came back papillary thyroid cancer, which is obviously the most common type of thyroid cancer. And it is the most treatable type of cancer, and most people get cured. I think someone did call it the good kind of cancer at some point early on, and I kind of just grabbed onto that because I wanted positive news, good news, or, you know. But as I have gone through all the doctor's appointments and all the pokes and prods, and now the surgery just last week or a week and a half ago, I can tell you that it is anything but good. So it's treatable. It's a very treatable cancer. So I guess that's where we should all gain our comfort. If you've found yourself recently diagnosed, or if you suspect, if your doctor suspects that you have this as well. I will be getting radiation or radioactive iodine. My endocrinologist explained all this to me during our appointment. So that's kind of it. I think that's kind of it in a nutshell for the most part. My next video will be a brief video on my surgery that I'm still recovering from currently. If you have any questions or anything, feel free to I don't know, ask down below, or I'm not really sure how this works, to be honest. So try to reach out, maybe in the comments, and would be my guess. Otherwise, I'll make another brief video about the surgery and my recovery thus far. All right, thanks guys.